I'm an audiologist in private practice in Austin, Texas.
Okay. And then how did you get started doing that?
Well, I became an audiologist by going to school at the University of Texas at Dallas. I did this after I had gotten a bachelor's degree in biological sciences. I wanted to find something that I could do that I felt more fulfilling than teaching biology, for example. And so I went to a career decision program and was tested, and one of the places that was a match was this type of field. Callier Center is considered to be a very good training program, and I was lucky to be in the same city as they were. I feel like I was exposed to a lot of ideas and a lot of research that was very helpful to me. I have been an audiologist technically since 1983. I have worked in different types of places professionally, including being a staff audiologist at a hospital and working in research and working in various medical practices. After my husband and I, Ron, moved to Austin, there seemed to be a chance for me to start my own business. And so Austin Hearing Services was started in 1999. It was incorporated then. I thought it would be fun I actually thought it would be fun to do something that I could craft to fit a model that I thought would be a good one in terms of being able to provide hearing-related services to people. I'm mainly concentrating on hearing aids and assistive listening devices, and most of the people that I see are adults, although I have seen a few children. What I want to achieve with my practice is to provide a superior standard of service. I really want to have the type of service that I would want to have if I were that person walking into somebody's place, where I felt like I really understood what the process was, where I understood what was happening with my hearing, and where I understood what my options were, where I felt that I was being treated fairly, and where I felt that the prices were fair prices that I could feel comfortable with, where I felt that I was getting a good value for whatever I was buying. I really like to develop long-term relationships with patients. I've had patients since when I was working part-time in a doctor's office after we first moved to Austin. So I've had patients that have been my patients for over 10 years now, and actually who sought me out after I started my own practice. I really like the feeling that people trust me enough to come back to me over time, or that they trust me so that they would refer their friends to me. It's a relatively small practice. I try to maintain a certain standard of quality as a result, but I also want to be able to offer services to as many people as I possibly can. Well, I guess one of the things that I can point to is more often than not, people will say I have done a more complete job with them. They feel like by the time we get through, we've really covered all the things that they were concerned about. They're concerned about what their hearing is like and what's going on with it. They're concerned about understanding what's going on. They're concerned about knowing what the options are. What are their options? Because they don't routinely shop for this type of thing. They're always worried. I think a lot of people are worried that they'll get into a situation where someone will tell them, oh, you really need this, and they'll find out later that there was really something better or something different. And so I try to tell them as much as possible and give them information to hold in their hands and go through later, where they know what their options are. I want everybody who comes through my place to succeed. I really do. If they succeed, then I feel like I've succeeded. and I want them to get what they need. I actually have an example. There's a guy who's a new patient of mine, and he came in with these internet hearing aids on his ears. He really did. He said he'd been seen by really good ear, nose, and throat practice here, and had been fit in the past, but he had decided this time that he would save some money and he would go on the internet, and he could, since he's a software engineer, he felt like he could handle this. And as I was trying to talk to him when he first came in, he couldn't hear me very well, and he was wearing them. They had programming that he could do at home, and some foam tips that he could insert into his ears. It was a big waste of money, I think. He ended up buying the highest end, I don't know if you need to, well, it's the highest end Phonak standard behind the ear hearing aids because they work. Because they work, and I can get them to work. And we did real ear measurement verification, and we tweaked them, and we worked with them. And he said, "Gee, I didn't know that it was this involved." It was a terrible waste of money. And unfortunately, since there's nobody sitting down there with you to make sure everything is okay, it's hard to do it. There's actually many more steps to this than people often realize. It's more important to me to fit somebody correctly than to push a particular product. It really is always about the people. You can't, I used to tell people I'm really fickle. It depends on who has what. And with AAA coming up later in the middle of next month, that's when everyone plans their product launches. And so I'm going to be watching very carefully to see who does what that's new and different. I think I'm an advocate. I think when someone comes in and they have a hearing problem, I am their advocate, and I'm trying to help them find solutions more than I am a salesperson trying to sell them something. And this may be a bad approach, but it's an approach that or maybe a great approach. It's an approach that I can live with. I can live with feeling like I'm there to help them, and I'm there to help them try to figure out what they need to do.